Some patients have a condition called blepharitis, which is a lot of inflammation at the base of the eyelashes. Here we're seeing a fairly severe example of blepharitis, and one technique we're using is to actually clean that off manually.
Yes, and there's different tools that we can use. Blefx would be a other brush that is used to kind of clean the lid margins. We use a makeup applicator, basically, that is a tiny little brush, micro brush, like 1 to 2 millimeters in diameter, on a rotary tool to clean the bases of the lashes, just so we can get off as much debris as we possibly can. As you can see, there's lots of crusting at the base, lots of irritation, lots of inflammation. And what we found is usually using this, patients feel a lot better after it.
Yeah, this is manual removal with just jeweler's forceps, just to remove some of that extra debris there. The rotary tool does a really nice job cleaning a lot of that off. We soak the tip with usually just an eyelid wipe.
Yes.
And that'll soak it really nicely.
And the reason why this patient needs this, and we do it on her about every 2 weeks, is she has a bandaged contact lens in place, severe exposure keratitis with, as you see, a conjunctival flap to protect from exposure, repeat contact lens application. She had a corneal perforation from an ulcer. There's so many things going on. So anything we can do to decrease the bacterial loads, which oftentimes is associated with blepharitis, the better, the more likely the patient will continue to have an eye.
And the reason I think you were seeing that those fibrovascular bands is that's actually conjunctival tissue that's been pulled up to cover the perforation that occurred in the cornea from a corneal ulcer.
Correct. And here again, another example of being very cautious and checking for leaks, because this is still fairly early, less than a month, I think, after the initial surgery. Just checking with stain to make sure no fluid is leaking out of the eye.
At the time this video was taken, there's still some sutures in the cornea, but most of those have been removed since this video was taken.
Yes. All of them except one, and the one is not causing any issues. It is covered on the conjunctiva. So for now, it's being left alone.
So how often do you think this lid treatment needs to be repeated then for this patient?
So this patient we have now settled on every 2 weeks, because it seems to be the best balance. It is somewhat irritating. You need some time to recover from this, but then you get more buildup of the inflammation and of the debris on the lids. So about every 2 weeks is what we're doing now.
And just removing some of that mucus can be so satisfying and helpful for the patient, because that mucus is really quite irritating on the ocular surface. This is just removal of the bandaged contact lens in the other eye. Beneath that, you can see a condition called band keratopathy. This patient has other issues too.
Yes, end-stage glaucoma. She's blind, but the contact lens also gets gucked up, for lack of better terms, from that additional discharge and debris and mucus. So removing and cleaning it also helps the contact lens last longer.
Yeah.